Will Roberts, welcome from
Thank
VAMHAR,
you.
Vermont Association for Mental Health and Addiction Recovery.
A mouthful.
Great, super. You're joining us. We learned about you because we have a community producer, Ed Baker, who does a series called the Addiction Recovery Program. And you have used that program as a series as part of a learning module on VAMHAR's website.
Yeah.
So that was just a neat way. I love this about community media, is that we, build these kind of amazing connections to folks. But before we get into that learning module that VAMHAR has, tell us a little bit about who you are and VAMHAR.
Yeah, so as you know, I'm Will Roberts. So I'm the Director of Training at VAMHAR. VAMHAR actually has been around since the late 30s. Yeah.
Wow.
Of the 20th century.
Yeah.
And it started as this this project of the Women's Garden Club in Montpelier, and just stuck around, grew, and helping folks deal with addiction, deal with mental health issues, stuff like that. So a big thing, so we've had a number of various projects over the years, but a big component of what we've always done is training. And I am incredibly fortunate to be the Director of Training. So, so we train professionals, recovery coaches, mental health professionals, psychologists, whatever, in how to work with folks that are dealing with mental health issues, with addiction, with recovery, and whatnot. So,
And are you a statewide resource, a national resource?
we are statewide. So, so we are a nonprofit, and we are statewide, but with, and we're going to get into this in a little bit, but with our learning management system that we have, this learning platform, that can be national, that can be world. It doesn't matter because it's all asynchronous learning on the web, basically. So.
Wait, I need to know a little bit more about the history. So 1930s, this women's garden.
38, I believe,
1938.
yes.
Because we think of, or at least I am in the mode of thinking of mental health as something that we're only just now learning to talk about. I mean, there have been activists and advocates, of course, for years. Tell me a little bit more about how this history informs who you are today and helps you do the work. And
Well, mental health as well as addiction recovery, folks have been working with these populations for centuries, you could say, in some form or another. I mean, it's all evolution, right? So I think we are better now than we were 100 years ago. But it is, it's a real issue, and folks in our communities are dealing with multiple issues, of course, but folks in our communities are dealing with various mental health issues. Families are dealing with those mental health issues. Same with addiction issues. So it's a real thing. It's a real issue, and we at VAMHAR are really fortunate, lucky, blessed to be able to help those folks. Maybe not the folks that are dealing with a mental health issue or dealing with an addiction issue, but we are able to help those folks who serve those people to be better at what they do. So we can do that through training, we do that through legislative advocacy, we do that through presentations like this, we do that through newsletters and information sharing and all of that kind of stuff.
Let's take a look at your website and look at some of the programs that you do, because you mentioned the training module, but you also mentioned legislative advocacy. I know you have a Beyond Bars. So maybe we have up there, recovery-friendly workplaces, Beyond Bars. Tell us a little bit about the programs.
Yeah. So trainings are right there. Recovery-friendly workplaces is an initiative that we have had going on sort of informally for a couple of years now, but it is now becoming much more formal. What that is that a company, an organization, a workplace signs up with us, and we help them to be more recovery friendly, which is helping the folks, because addiction recovery, mental health, there's a lot of folks in our communities that are dealing with stuff, right? So they are in the workplace. And so this program educates companies, educates employees, staff of those companies to be more open to different policy changes, to be open to people taking time off when they might need to take some time off for various issues, things like that. It's really cool. It's a very very user-centered program, if you will, because each company is different, each set of employees. So our director of operations, Lisa Lord, manages that and trains these various companies. Some companies she works with are like hundreds of people. Some companies are like 2 people, right? So because it's Vermont, right? So she really tailors how she works with folks to what that company is. And me as the training director, I have helped her design how she trains those individuals.
Do you want to talk a little bit more about other programs of VAMHAR? How else do you approach?
Yeah, so I would say our other we have a pretty broad social media presence, pretty broad, send out newsletters. We have a very good open rate for our newsletters, right? So that means people are opening them and they are reading them, right? And we can tell all that stuff. But our other big thing is our training, right? So, and that's what I design, facilitate, deliver all of our trainings.
Right. Before we we'll get into the training segment. I just want to know a little bit more about how VAMHAR approaches sort of the concepts around mental health, addiction, recovery as either an individual issue or a systemic. Like, how do you bridge that gap between like the effects of mental health on individuals and sort of how the system responds and the system's responsibilities?
Yeah, well, we are very connected with the communities in Vermont, okay? So we make it a point to have listening sessions where we go into various communities all around the state and talk to them about what they are seeing and what they want to do about it, right? It's not that that's going to happen, but that, for example, this happened just last year. Somebody said in one of these listening sessions, they said, I want to know, and a number of people had said this, we want to know how do you parent kids when you are in recovery yourself? So we designed a training around that.
Great.
Right? So we can do things like that. We can talk to legislators. We can't affect any, we can't submit a bill or something like that, but we can talk to legislators. That is state level, of course, but then also, for example, our director just had some conversations with Peter Welch and Bernie Sanders, right? So those kind of things, we can do those kind of things.
Known resource.
Right.
So let's get, and tell us, Will, just what drives you around this? Why are you passionate about this work? And then lead us into the training work that you do.
So I am a career trainer. Okay, so that means that I am trained in adult learning theory, and so I know how to, or I'd like to know, I'd like to think that I know how adults get from point A to point B to point C in their learning.
Cool.
Right?
Interesting. Yeah.
So I might not be an expert in an area, but I know how adults learn, and so I can get them there. So I work with trainers, we work with trainers outside of the organization if it's not something that I personally know about, or we can provide training, me doing it or others doing it as well. So I've been doing this, I've been a trainer for like over 30 years. I started back in the early to mid 90s with flip charts and overhead projectors and mimeograph handouts.
In person.
In
all in
person.
Yeah.
And so I've worked in the domestic and sexual violence fields. I used to work for the state, the Center for Crime Victim Services, working with crime victims. I've worked with child abuse survivors. I've even worked for a software company. That's a national company, huge company. It's based in Vermont, and I help them design training because it's not so much the exact thing, but I know how adults learn. And so if you have to learn software programming, I can do that, or addiction recovery.
Cool.
So I have been the director of training for a little over 3 years now. This is my favorite, out of all those jobs, this is my favorite job I've ever had. Super passionate about it. I am in recovery myself, and being able to talk about what I know, but also provide resources to folks that are actually working in the field is huge for me.
Yeah.
So that's a great thing.
So again, Ed Baker, who does his addiction recovery channel here, and he really leverages community media to make a difference in the world of addiction recovery.
He is an amazing guy,
all,
by the way.
Yeah, and then you all saw an opportunity to take a series of his programs and make a learning module out of it. And maybe we could go to the training offerings and sort of begin to dig into what are some of the trainings that you have.
So Ed and VAMHAR, but Ed and I, we have a history together, a great history. He's a huge supporter of us. I'm a huge supporter of his. And so I can't remember if he approached us or we approached him. Regardless, we created, he's been doing this addiction recovery channel for a long time, number of years. Yeah. So he gathered up a greatest hits, and we posted them on our learning management system. So our learning management system is called the Collective Learning Institute of Vermont. So collective being, the wording of all this is very important. Collective being that we bring in other outside trainers, like Ed Baker, right? And it's a platform that is really great. There are courses that are short, take you 15 minutes to get through. There are courses on there that will take you a couple hours to get through. And the platform is from a company that's based in Dublin, Ireland, called Learn Upon. And so
you sign up at that Learn Upon.
Yeah, so you go to, so we have a page, here it is right here. We have a page here where we can, you create yourself as a user.
And it's free.
Absolutely free. And you can go and take whatever trainings you want. The platform itself is phenomenal because if I take a course and I pass the course, even if I don't pass the course, I can take it again. I can download documents from that course. And it's not just asynchronous learning, if it's done well, and by the way that I did it, which is it's not just watching a video, right? there are videos in there, but it's about learners doing something, applying the learning, that whatever that learning is, applying it, and then taking away those knowledge and skills. That's what it's about. And so for me as a learner, I can come in here and I can take a course, I can pass that course, I can get a certificate, I can get CEUs. We have many of our courses, most of our courses, really.
Those are continuing education
continuing
credits.
Education credits
Yeah.
that can be applied to any kind of field.
Yeah.
So like if I'm a social worker, if I'm a teacher, I can use those CEUs for my credentials.
Yeah.
Right.
And I think Kevin was scrolling through
Yeah.
some of the topics. So tell us a little bit about some of the topics.
Yeah,
that
so
you have.
we have over 30 courses now. We have, I think we're up to 35. I'm about to publish another one today, actually. I'm working on a co-occurring disorder training right now, which I'm almost finished with. But this other one was, it's totally escaping me what I'm about to publish. But you can see here, though, we have got all kinds of trainings for recovery coaches, for just folks in the community. We have a plethora, job skills, parenting skills, whatever you want. And I think, personally, the offerings are really good. Rural poverty, there's addressing racial bias. So it's a really great offering. And like I said, it's free. It's a wonderful, wonderful platform. I used to work, as I said, in software. When I was vetting various LMS platforms, which there are thousands of them out there, I had a whole bunch. I whittled it down, and this Learn Upon platform, they were my favorite.
Nice.
Not only for user functionality, user ease, user functionality, but the administration side of things, which is me, the administration of those users, administration of the platform, super easy.
Great.
Yeah.
Cool. So during this time, tell us a little bit about what makes the work harder and what makes the work easier for VAMHAR.
So the hard part, of course, is funding. We are a nonprofit, as well as anybody who has been paying attention to the news can tell you, funding sources are drying up. So that's a bad thing.
Are you affected by federal funding cuts or?
Oh, most definitely.
Yeah.
Most definitely. So we are affected by federal, state funding, and we're not alone. Nonprofits all across the country are dealing with the same issue, and since those federal funds are drying up or being cut off, folks are having to seek out private donors, private funding. But that's all well and good, but we're all doing it. So there's only a certain amount of money out there. So that's what is the most challenging thing. Addiction rates are on the rise. And conversely, federal funding is drying up or being curtailed, state funding being curtailed. And so that means resources for folks that are on the ground, either dealing with their issues or folks that are on the ground working with those folks, they're getting their funding curtailed as well. So I would say funding is the biggest thing right now.
Biggest obstacle.
Yeah,
And what fills your cup? What makes the work easier?
For me, I am incredibly, I'm incredibly grateful every day that I get to do this work, but that I get to bring something to light that has been kept in the dark. Recovery, mental health. These are topics that I felt this way when I worked in the domestic violence field as well. These topics are something that we don't talk about, or that, it doesn't happen in my family, it happens over here, and being able to bring light to these topics, which, it infiltrates all levels of society throughout culture, whatever, right? Being able to bring to light these things is so rewarding. That's why I've been doing it for over 30 years.
How do you crack the stigma nut? What are some ways that you, when people, get to that place where how do you get through, how do you break through it?
Yeah, stigma is a big thing. So, I think first and foremost, be honest and open in your conversations, with anybody. Also, calling out words, that's a big thing. So, for example, you wouldn't, if I'm talking to you about addiction, I'm not going to use terms like drug addict, junkie, these things, or if somebody's, dealing with mental health issues, nuts, crazy. All of these words are stigmatizing words because they have a connotation in our minds about something. And then what stigma does and what words do is they other people. And then when you other somebody, then they are less, right? So you want to get away from that. So if you've noticed, just in my conversation just right now, I've used people first language. So I've said folks that are dealing with addiction, the people that are dealing with mental health issues, right? So it's people first, because you are a person. We're all all of us are a conglomeration of a whole bunch of stuff. Sometimes that stuff on the surface, sometimes it's below the surface, but it's our stuff, right? And so by acknowledging that I'm a person dealing with my stuff,
there you go.
There you go.
Yeah. What a great way to think about, how to crack the stigma nut. Just put the person first. And let all the other stuff be.
And
part of their path.
And the thing is with words, just the last thing I would say about words is that, and I talk about this in training a lot, where what about the word alcoholic, right? That's a word, Alcoholics Anonymous, right? That's a word that a lot of people use as an empowering thing. And I totally support that. But that's not for me to say that you're an alcoholic. That's for you to tell me. So if we are talking about your drinking, I'm not going to be like, well, your alcoholism is X, Y, and Z. I would say, yep, it is sometimes hard for you to not drink during the day or something like that, right? I'm not going to put a label on you. Stigma, it's about labeling. And, you can say that about stigmatizing mental health, stigmatizing addiction, also stigmatizing race, culture, gender, whatever the thing is. Othering it divides and conquers. And we're seeing that a lot.
Will Roberts, thank you so much for joining us here, talking about VAMHAR, the Vermont Association for Mental Health and Addiction Recovery. And you can find them at their website. It's right there on the screen, www.vamhar.org. And you can go on there and sign up for free for their learning module, Learn Upon, vamhar.learnupon.org. .com.
So yes.
Yep.
So that one is a .com. And then also you can sign up for our newsletter, which allows you to get updates. When I create a new training,
Okay.
you'll get an update as to that, and you can see it.
Great. Well, thank you so much for joining
Thank you.
us. And that was great nuggets to share.
Yeah.
And thank you all for watching.
All right.